unlikely to have flu and strep and COVID all at the same time. It's not impossible, but one of the rules in medicine is that you try to explain all of your signs and symptoms with one cause. So the likelihood is that if a child comes in with headache, sore throat, fever, stomach ache, and their strep is positive, that's what they've got, and they don't have COVID as well. But it is possible that they can have two different illnesses at the same time. So far, the data it shows that it's very unlikely for someone to get COVID again, especially in the first 3 months after an illness. The CDC has really put out that you can be essentially immune to the illness for up to 3 months after the infection. Beyond that 3-month period of time, it's less clear how long your immunity lasts. So at this point, if you were to get exposed again and it had been less than 3 months since you'd had the illness, you are not required to quarantine like you would had you not ever had the illness. But if it's been longer than 3 months, you would have to do the same quarantine just as if you had never had the disease before. The FDA emergency use so far has approved it for ages 16 and up. So children under 16 are not in that group as of yet. And the reason behind that is that the FDA felt like that there just wasn't enough data in that age group to be able to provide that emergency use authorization. I do think that they will continue the studies and incorporate more children to be able to get that approval, but I'm not sure what the timeline for that will be. It may be several months down the road. I definitely think that we have seen a trend of avoiding the doctor's office altogether. Certainly we saw a decrease in our well visits because of fear of coming into the office. We have really tried to reach out and explain the importance of getting their routine physical exams, their routine immunizations. We still are seeing much fewer sick visits than we would be seeing traditionally this time of year. Part of that is probably because there's less illness out there due to the measures that we've put in place for COVID. So wearing your mask, being socially distant, works well for other illnesses that aren't as contagious as COVID. I do think televisits are here to stay. They have been very helpful in our practice. We have wanted to try to figure out a way to incorporate them for the past several years, but up until now, they really weren't covered by insurance. The coronavirus has definitely changed all of that. There are lots of services that we can provide via telemedicine more efficiently than we can by bringing them in the office, especially with our teenagers that may need, a medication check or something that doesn't necessarily require a full physical exam on them. There are lots of little quick and easy things that we can take care of via telemedicine. So I hope that it will remain. We have definitely seen an increase in depression and anxiety over the past several years in our teenagers. And a lot of that, I think, can be attributable to the rise of social media. Social media is, touted as getting us more connected, but in reality, it creates a lot more isolation. You add in, on top of that, the isolation that has been created by online schooling, shutting down during the coronavirus, and you have seen this explosion of the increase in depression and anxiety over this last year that we have seen with our adolescents. I definitely think that the unknowns about the virus, the instability of whether or not I'm going to be in school next week versus being quarantined next week, all of those things impact the kids. One of the things that I always talk to my patients about is trying to think about the different behavioral things that we can do to improve their daily activities. So I try to get them to make a list of things that they enjoy doing and things that really just make them feel normal. It doesn't have to make them feel excited. I just want them to feel normal. And I try to divide those lists up into 3 things. So things that I enjoy doing by myself, things that I enjoy doing with my family, and things that I enjoy doing with friends. And I try to get them to be very purposeful about including those things in their weekly activities. Because if you leave it up to them to just do it whenever, it's like any other chore that doesn't get done. You almost have to add it to your calendar like an event. The more times that they spend doing those things that they enjoy, the more positive feedback that they get and the better that they can feel. We always need to find a way to get the wiggles out for kids when they are kind of stuck in these very structured environments at school because they're trying to keep them separated and safe. I definitely think it's important to get kids outside playing every day. A lot of our families have tried to adjust to it by having just a few friends that they routinely play with. So you might keep your groups small, just a couple of friends that are the same friends all the time playing outside, trying to keep them, at their distance for shorter periods of time. I would try to, avoid any kind of prolonged interaction, and especially interaction inside, to keep them safe.